Hi, everyone. We're just letting people in. Welcome to the Public Health Liaison check-in. We're so happy you're able to join us today. We're just going to wait for a couple more people to join us. Okay, well, let's go ahead and get started. So my name is Michelle Drake. I'm with the Marin County Office of Education Rethinking Schools Task Force. I'm accompanied with my colleague, Melina Boyd. And then, of course, we have our Deputy Public Health Officer, amazing Dr. Lisa Santora, joining us. We're going to go through a brief overview of current status, and then we will open it up to check-in and questions and answers. So thank you, Dr. Santora. We just got off a call with our whole community. We had over 100 people joining that call. If you were unable to join that call, there will be a recording that will be on our website within the next 24 hours. So thank you again and welcome.
All right, it's my turn now. So the good news is that we are now in tier 3. We are in the orange tier, and we're looking for a tagline or slogan for staying in orange. This is not what you're seeing across the nation and across in Europe, but this is what is true in Marin County and the Bay Area, as well as we are seeing much lower rates in California compared to other areas. And that really is because of the strict measures that we've taken since March and all of the sacrifices we've made together to flatten the curve, which we did. And we now have, we've reached all the criteria for orange, except we've actually have met criteria for yellow in the positivity. We have now less than 2% of all the tests completed in Marin County are positive for COVID-19. So that shows that all of our hard work has been effective, and which allows us to return to in-classroom instruction, which we're really excited about. You can jump to the next slide. So effective last week, we now no longer have a shelter-in-place order. We now have a risk reduction order. And so this is a major change. We used to implement environmental policies and rules and orders to keep people in their houses and to slow and stop the spread of COVID-19 transmission. Now it's changed, and the responsibility is shifting to the individual level, where we are going to be providing guidance at this point, but it really is up to individual members of our community and families making decisions to engage in lower risk activities. So it's a big shift for us, but we're ready for this shift. That being said, everything with COVID always changes. And if we see increasing rates of COVID-19 because of the reopening activities that we're seeing and because of COVID fatigue, we will absolutely consider implementing new orders if necessary. The goal is voluntary compliance always, that we all are working together as a community, but there are times where we do need to effect public health orders to achieve the behaviors that we hope to see. But we're hoping that everyone doesn't run wild in our new tier of orange or tier 3. We're hoping everyone stays committed to the cause of keeping COVID at bay and keeping our case rates low. So that's a big, exciting news for us.
Marin has officially lifted the shelter in place.
What's that?
We've officially lifted our shelter.
Oops. Yes, that is the message of today. So with that being said, we are working now to update our handbook, and I apologize. This is one of the challenges of being a public health liaison and COVID times, is I know many of you were just getting used to having the decision tree for tier 1 and 2. And now that we're in orange, we just got used to it, and now that we're in orange, we're going to change it. We negotiated with the nurses, who are amazing, our Marin School Nurses Organization, who are working tirelessly to make sure we have all of the right decision tree ready for parents and students and staff. So we've listened to them, we've updated it, and it will not go into effect until November 9th. So that will provide, we're hoping to have it released hopefully tomorrow. In the English version, there might be a delay in Spanish translation, and we apologize for that. It's still getting the final approval from Dr. Willis as we are getting ready to release it, but it's going to be a major change. And with this, there's a couple of reasons behind the major change that you see. One is that we now have very clear definitions of what we call the case definition from Centers for Disease Control. And so that is the first reason. The second reason is right now, like I said, of all the tests that are being completed in Marin County, less than 2% are positive for COVID-19. And what we're consistently seeing anecdotally and objectively is when people are presenting with just a runny nose or just a fever, that it's not COVID-19, it's another virus, it's another seasonal cold. And so those are the two guiding principles on why we are relaxing some of the restrictions that were in the past the safety decision tree for schools. So we really have identified there's key symptoms of COVID-19. Those are cough, shortness of breath or difficulty breathing, and losing taste or smell. And that last one, the loss of taste or smell, is, if you hear that, it's almost always COVID-19. So that is going to follow the same test or 10 protocol that we had before, where the siblings and household contacts have to stay at home. They must schedule a test for COVID-19 or a healthcare provider evaluation. And I'm going to add an asterisk on that one. If they test positive, they're going to have to isolate. If they test negative, that's when they can return to school, as long as they're fever-free for more than 24 hours without fever-reducing medicines and their symptoms have improved. If they're negative and they're still sick, their siblings can go back to school. But with this one, we're going to need at least a COVID-19 test or a healthcare provider evaluation. The asterisk there is that there's certain conditions, for example, asthma. A child may present with asthma or has had known asthma, and we'll see a healthcare provider, and it might be a classic asthma exacerbation. In that situation, they would be able to see their healthcare provider, who may report that they saw the patient, they evaluated the patient, this is a classic asthma exacerbation, and they're not recommending a COVID-19 test. So that allows room for a child with a known chronic condition like asthma to have a healthcare evaluation and not get tested every week or every other week for COVID-19 when they're having an asthma exacerbation. So that's important. The next blue box is underneath identifies if a child or staff has 2 or more of the listed symptoms. So these are the symptoms that are listed by Center for Disease Control, but you need 2 or, as before, it was the same list of symptoms that you saw before, but now you need 2 or more of these symptoms to be grouped in the test or 10 group. And so now all runny noses are not going to be considered COVID-19 until proven otherwise. You really need 2 symptoms in this list in order to, one symptom can send a child home from school, but 2 symptoms sends them down the path to the test or 10. So it's the same pathway if they have 2 or more symptoms. Going down to the next box, if they only have 1 symptom, the child should stay home, or the child should be sent home from school. But in this case, the siblings or other household contacts do not have to stay at home and do not need to be sent home from school. So this group of individuals will be able to return to school after their symptoms have improved, as long as they're fever-free for more than 24 hours without fever-reducing medication. In meeting with the nurses, and we really understand this is again placing, depending a lot on parents, for accurately reporting how their kids are doing, and for understanding whether their children are engaged in any risk behaviors that might mean, even though it's only 1 symptom, maybe they should consider the child for COVID-19 testing. And so what we are adding into that handbook is it may be language that states that a nurse may require testing even if there's only 1 symptom, if they suspect COVID-19, if they suspect that COVID-19 might be possible. So that language is updated again, since we're not requiring now testing for everyone with every symptom on the list. There's still discretion for the school nurse to require testing for the student to return to school if there's any concern for COVID-19. And what might be, like, for example, a concern for COVID-19 is, and we really appreciate this, I don't get it as much in my work day as you guys get it, is You hear a lot of stories and a lot of reports of other people's activities that are not necessarily reported by the family or the parent themselves, but by other parents at the school that might increase your index of suspicion that maybe the student really should get tested, or maybe the parent really is medicating the kids, reporting that they only have, they had a sore throat and fever, but they were still sent to school. And so I think that we really understand that dynamic, which is why we want you as public health liaisons to know that you can reach out to the nurses if you have any concern that, you know, this kid really should get tested for COVID-19. They've been coming back and the child's reporting something different than what the parent is reporting on their screening. So we want to work with you there. And then, as always, the purple box is that any known exposure to a COVID-19 positive person really needs to stay at home and quarantine, and the students and siblings need to stay at home, and siblings and household contacts need to stay at home as well, unless that individual quarantine right away. So the classic example I use is a high school student. Let's say they went to a party. The party that I'm thinking of did not have any COVID-19, but let's say they went to a party and they found out after attending a party that someone else at the party had COVID-19. If it's in the right time frame, that students should be able to quarantine, and then the other siblings may return to school if quarantine was possible within the home. As always, we recommend that after exposure, you wait 5 to 7 days to get that test for COVID-19. And why it's important for us in public health is to have that information is just because it will help us guide public health action like other cohort closures or other evaluations. So the good news about all of this is you'll see there's less boxes than the last box. The hard news is that a runny nose is going to be treated as just a runny nose. And we know that that may increase fear and worry and anxiety as people are getting back into the classroom. But there's a reason behind that. And it's my fancy word, it's the pretest probability or the likelihood of a child with a runny nose who gets tested for COVID-19 having COVID-19 is significantly lower than it was in July when there was a much more COVID-19 activity in our community. And so again, this aligns with Centers for Disease Control's case definition for COVID-19. It does rely on parents and families really being honest and thoughtful in how they send their children to school and accurately completing any screening forms that schools may have. And we will, again, continue to listen to schools as they implement this and determine if there's any need for adjustment. Our hope is not. Our hope is that with the low rates of COVID-19 that we're seeing, with the return to school, that this is the right decision tree moving forward. We've had questions, since we're just in orange, shouldn't we stick with tier 1 and 2 just to be sure? We again remain confident that the school site specific protection plans that are in place, which treats everyone as if they have COVID-19, everyone's wearing a face covering, everyone's maximizing physical distancing. We think this is effective. We know this is effective because we haven't seen school-based transmission occur, even though we have over 100,000 student days, and we've had positive cases of COVID-19 in the school environment, and we've demonstrated our ability to contain that. So that being said, we will adapt if necessary or adjust if necessary, but this is where we are now. And our hope is to have this distributed tomorrow and translated no later than Friday and posted to all of our websites as soon as possible. But again, we listened, it won't go into effect until November 9th. So there's time for all the schools to adjust to these changes. All right. So this is our famous dashboard. Again, this is where we want to be transparent with our data to provide reassurance to the school community and the community at large that restarting schools and restarting in classroom instruction is not driving any increases in COVID-19 transmission at the school level or at the community level. So you can visit the website and see the map and click on the school, and we'll be reporting the known student cases and the known staff cases. And the important asterisk here is that these cases need to have created a potential exposure in a school. So we're not going to be reporting, let's say a student was out for the winter break and developed COVID-19 and there's no way the child was on campus or the staff was on campus to expose anyone else to COVID-19. We're not going to be reporting those cases. So the cases that we report of COVID-19 positive students and staff need to be cases that would have potential school-based transmission, potential risk for school-based transmission. So they would have to, we're not reporting students that are in virtual learning who test positive on this dashboard. All right. Halloween, I know some of you are in schools, just encouraging you to work with us on our messaging. Trick-or-treating is not allowed in Marin County. I know that people have been very creative to identify other strategies around making trick-or-treat safer. We are strongly recommending against trick-or-treating, even if there's thoughtfulness around being more safe with trick-or-treating. What I'm doing with my kids is walking from house to house with just another household outdoors and maximizing distance between us. And we'll be raiding scary houses, but we will not be knocking on doors. We're discouraging that because again, one, just knocking on general doors would just increase fear in the community. A lot of people have been, even though shelter in place has been lifted and we're now under a risk reduction order, many people have been sheltering in place, and it could be very frightening for them to see people coming to their house and feel overwhelmed by that. So that's one reason. Two, we really discourage having that less than we recommend staying more than 6 feet from someone else. So the nature of a candy transaction, the nature of it is less than 6 feet. And also the nature, if you've been trick-or-treating recently, the nature of trick-or-treating is kids gathering and congregating closely together as they're knocking on the door. Those are all activities that are against our risk reduction orders. So we're encouraging everyone to follow our risk reduction orders and not to trick-or-treat in the traditional fashion. That being said, go online. We're having a Spook Fest at the Marin Center where for this week, Dr. Willis and I are approving candied apples as long as people brush their teeth. You can have alternate fun ways to engage in trick-or-treating. The oral health program is on the call right now, and so they're just going to close their ears that I said that. But we can do Halloween well this year, and kids can still have fun without going door to door. Jump to the next one. My bibliography. So I don't know if you were on that call, but we were requested on one of our community conversations that we have, where are we coming up with all of this stuff? Well, we do follow the best research that's available to us. And so we've developed our references that we will be updating, we hope every week or every other week, and we've classified it by topics. The newest topics this week are on travel and on mental health and well-being, where we really are seeing the effects. I'm experiencing it firsthand at my house of my elementary school students, of the effects of not being able to socialize in the classroom environment. And so we really are just strongly so thankful to everyone on this call who are working together with us to get kids back in the classroom, even if it's in a hybrid experience, to be near in a safe way, near in a socially distanced, face covering way to other students, and being in that classroom environment, we think is really critical, not only for their academic achievement, but also for their social and emotional development. And then on travel, and this is timely as we move into the holiday seasons, there's increasing evidence around long haul flights. So those are longer flights and the risk of COVID-19 transmission on long haul flights. So really discouraging individuals from long flight travel over the holidays. Dr. Willis was on another call with us, the community conversation that some of you may have been on. And he mentioned that there may be a joint quarantine order possible for those who are returning to the Bay Area from areas of higher risk. We are at a place right now where California is having the lowest rates of COVID-19 across the nation, and other parts of the nation and world are having significantly higher rates. So traveling outside the Bay Area and traveling outside of the state can actually be much riskier than it was a month or two back when we were having the highest rates. So we're just encouraging everyone to be really thoughtful about their travel. If you do travel out of state, to follow the guidelines that are in place for the state of California. So don't don't adapt to the local culture of not wearing face coverings and not maintaining social distance, really not going into crowded places, maintain the behaviors that we've developed over the past couple of months together, because that is going to be safer, and that's what's going to prevent us from having to close schools after holidays. So I think we can jump ahead. That might be. Oh, and just to be the broken record, I am sure not 100% of people on this call have gotten their flu shot. It's never too late to get your flu shot. I'm going to be saying that until April. So it's time to get your flu shot. And really, again, that's our one way to protect our healthcare system. I think that's it for me.
Okay.
And I just, go ahead.
No, go ahead.
No, I just want to thank everyone. I wanted to thank the County Office of Education team and our public health team and the school nurses team again, and to all of you on the call today, getting your master in public health. We definitely should probably develop a certificate for you. We are getting schools back only because of your efforts, and we really appreciate the extra work that you've been doing to learn about public health and to learn about isolation and quarantine. And we're just really thankful for you being here, and our team just wants to be present for you and feel, in order to ensure that you feel supported. That's what our job is as we open up schools together.
Thank you, Dr. Santora. So right now, what I will do is, and you can unmute yourself, please feel free to ask a question, but we'll start from the chat. Tracy Edmonds, do you want to ask your question? I'm happy to also ask it for you. It's basically if the symptoms are intermittent, i.e. sometimes people have sniffles or a runny nose, how do we treat that? And do symptoms need to be consistent?
So intermittent symptoms can be treated for each event. I think that's where if someone that's a public health liaison at the school level, if they're concerned just because the child is just not getting better, to contact your school nurse, and then that might be the time where the school nurse invokes the that you're required to see a doctor. It's been too long, because again, part of our role is again just reassuring the school staff and teachers it's safe. And even though runny nose is most likely, it's very unlikely right now, actually, it's very unlikely that a runny nose or sniffles is COVID-19. We know as people are coming back into the schools, it can be frightening for some people. So you can treat each intermittent as intermittent unless there's something that makes you concerned, to contact your school nurse or contact our team, and we can review it with you and determine if we would recommend that the child get evaluated. So first, contact your school nurse. But if you're having any questions, you can always contact our team of nurses too. And then there is a second part.
It was, do they need to be consistent, the symptoms?
In what sense?
Tracy?
I think this goes to somebody saying, hey, I had some sniffles last night, or I had some congestion last night, but I woke up and it's fine now. I guess the question is, is there a threshold for it needing to be consistent and ongoing for it to fall under the work that we do in our screening?
That's a good question. I think this is where it's trust, and we've had these cases where people will attribute their sore throat from allergies, and then people will attribute a lot of the symptoms to allergies, and then it goes away and then it comes back. If there's any nagging, I would encourage you to encourage your staff, why don't you, especially as essential workers, to just get tested. If there's any nagging feeling that it might not be just a sore throat from pollen or whatever. And again, I think that's where, if you ever have any nagging feeling, to call our team. We'll be happy to kind of review those nagging feelings. It helps us to hear what you're dealing with at the office level, to understand if we're on target with our recommendations, or if we need even just make modifications in language. So I know that's not a very specific answer, but Sandra, do you have a better answer than?
No, not really. Hopefully the new guidance, the new tier 3 guidance will kind of ease up some of these kinds of issues, because you really do have to have either a major symptom or 2 or more symptoms. So just a one-off thing like a runny nose or some throat irritation by itself won't necessarily trigger the whole COVID thing.
And that goes back, that's how we were managing runny noses and before we changed it when, again, it's one of those times where we wish we maybe weren't managing it that way before when we were in purple and red. But to reassure everyone, when we were managing runny nose in that same way of just, just monitoring it, we didn't have any school-based COVID-19 transmission. The exception to that, and just is always in that those home-based preschool environments, which is much more like a home environment, is a much riskier environment where you might have heard that, oh, there were a couple of kids with runny noses and there might have been transmission in that type of environment. That's very different than the environment at schools. That's the caveat to that. But when we were operating with our runny noses allowable framework, we did not have any school-based transmission for those months, honestly.
So the next question is from Emily Cox. It's in reference to mandatory or requiring testing. She had 2 staff members stay home to self-quarantine because they were concerned they might have had exposure to COVID, but they decided that they did not want to be tested themselves. So how to handle this sort of situation? And then, what if they do have symptoms and also refuse to get tested because for whatever reason that they don't want to be tested?
Yeah, I wish that I said I wish I were kidding, but yeah, we've got some conspiracy things happening. I don't know.
So we can only we had an issue of an outbreak at one of our work sites at the county, and in an outbreak setting, and it's not a big outbreak, it's small, but in an outbreak setting, public health can require testing. So if a school has an outbreak like measles, or we've done this in the past, if a school has an outbreak, we can require testing. If there isn't an outbreak, we cannot require it. What I would recommend in those scenarios, and I appreciate the frustration, we always want people to get tested because it really helps inform the guidance that we provide and the public health actions we have around closure and exposure. And really think it's always best to know. That's my opinion. It's always best to know, so we always will recommend they get tested. I would encourage talking to your leadership if this is an ongoing problem, and offering from us, if it is an ongoing problem, offering us to even do a check-in with your school staff to help understand why it's important. Again, we want to keep schools open. Having staff out unnecessarily is not a benefit for the school community at large, from students to teachers to parents alike. So let us know if you need any additional kind of one-off conversations with your school. We could be available for that.
Yeah, definitely. I think that would be a huge help. And since I am school leadership, I'm appealing directly to
Email me offline and we can set up a time that's convenient for your staff. Maybe we can just do a mini town hall, if that would help you. And that's that's a great example of where we want to be available and we want to hear what's happening. But there's no good clinical justification now. We don't do a deep nasopharyngeal swab. So we're doing mostly anterior or mid nose swabs. There's even oral swabs that are now available. So the discomfort, and that might have been real for many who had early nasopharyngeal swabs, is not the case.
That something's happening with the genetics.
I'd be happy to talk to them.
Thank you.
So the next question is in reference to the template letters from our exposure protocol document. So yes, those are forthcoming. Public Health is in review of those letters right now that are connected to the various scenarios, and those will be updated and then placed on our website. So thank you, Gail, for asking that question. And then Teresa, the question is if we do have a student who is COVID positive and then they have more COVID within the household after they recover, how do the protocols work for that student?
You go first, Sandra.
All right. Actually, once the student is COVID positive and they complete their isolation period, they're all set. They can come back to school at the end, and it actually doesn't matter what else is going on in their household, unless there are siblings that also attend the school or something like that. When they get COVID, their body launches an immune response and builds up immunity against it. at the end of the 10-day period, they're good. They're not contagious. They're not shedding virus. And they are not unaffected by the people around them who do have COVID. So they're not going to carry COVID from their household to school. So nothing special is required for them.
Thank you. Oh, we wanted to go back to the dashboard, Michael. Michael, do you have a specific question in reference to the dashboard or the school handbook?
I did put a link to the dashboard in the chat, just in case anyone wanted to look at it more.
Thank you.
Can I ask a follow-up question, Michelle, on the
Sure.
previous question? Sorry to interrupt. So if a student has COVID a month later, they answer yes to that question because their mom gets it a month later, they still can come, or is that a whole new process?
No, they can come to school. If they have had COVID and recovered from it, they're all set for 90 days. And we don't worry about other household members. And we also don't worry about, like, if a month later that kid gets a sore throat and a fever, we just treat it normally like we would any illness prior to COVID.
Would that be the same for adults?
Yes, everybody, 90 days. After 90 days, we don't know how long the immunity will last. So at that point, we start to treat them like a regular person again, with all the protocols and things that we put in place.
And just for you guys to know, we now are beyond 90 days, and especially with our nursing home population that had a lot of cases of COVID-19, and we have yet in Marin County have had a reinfection even beyond 90 days, even if they develop symptoms like cough and fever again, when we've not had a case of reinfection. That being said, this is where it's challenging in COVID, where research is still developing around immunity, and we don't have the soundest guidance except our 90-day number. What would happen if someone does, let's say it's after 90 days, and we've had this, it's after 90 days, and they get tested again, because it's been more than 90 days, they have cough and fever again, they get tested. We actually do another analysis on the test. It's called cycle threshold. And if it's a high number, then it's considered still to be an old infection. And all the cases where we have been evaluating possible reinfection, but we are still seeing it's old infection. So that test that we have for that PCR test is so sensitive. It detects genetic materials from months back when done. And so that's what we're finding still. So yeah, there have been confirmed cases of reinfection. There's still only a couple of cases documented of reinfection. It is possible, but at this point, it's not common. And but we are still going to stick with that 90 days. And we know that makes it tough. It's kind of easier right now, but the longer we get into a school year, it's going to be a lot harder for us and to remember who's been COVID positive and who is really 90 days. And that's where we're really thankful to have Marin Community Clinics and other pediatricians and healthcare providers helping us in the communications with the schools, because it'll get harder as we get longer into the pandemic.
Along those same lines, if someone is tested positive, they should not retest for 90 days afterwards. So this is for staff and for students. So if your school is doing any kind of routine testing, don't let that person test again, 2 months later, because if they test positive, it's likely sort of residual from their previous infection, but it doesn't mean that they're contagious.
That just makes you think about your body in a different way, doesn't it?
It really does. I mean, it really does. Carrie Robley, your question in reference to the joint quarantine, can you expand on that?
Sure. We have a lot of families who we know are going to be traveling. And so as a school, we're trying to, put forth a policy or a stance that we're comfortable with, knowing that some people will be forthcoming with their travel plans and some won't, and knowing that they're going to be traveling out of state potentially, which is, I guess, a little more unnerving for us here in the Bay Area. And so I'm just wondering if there is going to be a quarantine for families if they do travel out of state.
it's seeming more possible now. Matt's meeting with the Association of Bay Area Health Officers this week and on Tuesday, because the goal would be not to have Marin County be a one-off, but to have a Bay Area approach. But we are, if anything does get issued, it would be most likely quarantine if returning from areas of higher COVID-19 activity. And you might not have been on the last call. I'll share it. I'll share it in the chat here. There's a link to the CDC website that has where there is higher COVID activity in the past 7 days to help. Hopefully we have parents be informed about their travel decision-making, because if a family wants to take a car and go to Yosemite in the middle of winter, that is a great idea, super safe. If they want to go though into, if they're flying back to the Midwest, they can do it safer, but they have to be aware that they're in a higher risk activity. That's where we also would say you should follow California recommendations and guidance around how you are traveling in those higher risk areas. So face covering, where there's many states that don't have the face covering laws that we have in the state, and don't have the same restrictions on businesses. So restaurants are completely fully open. I watched the World Series and I was blown away when I saw the crowds in there, and it's outdoors, but that was really surprised that was allowed. But I even had to Google where it was happening, because my husband was telling me it was in LA. I'm like, this could not be in LA. So it's different in different parts of the state. And even where there's higher COVID-19 transmission, they haven't changed some of the business and allowable activities. So I think it's going to be very much centered around that, but I'll share the link to the CDC, and that might help inform even a recommended quarantine if they're returning from a state with high risk activity, and self-quarantining for 14 days. The only thing there is we are considering if there might be a test out option. So a potential abbreviated quarantine in these scenarios where potentially 7 days after travel, they can get a test and return sooner. So that's, again, you guys are seeing again how the sausage is being made. The sausage gets made where we try as a county to align with the whole Bay Area when there's a delay in any guidance coming from the state. So the health officers of all of the Bay Area counties, from Santa Cruz all the way up to Sonoma, Napa, we meet. We discuss these challenges that are upon us and determine if there's a policy level that would be applicable for all of the Bay Area. And that's what this one's feeling like. That it would be one not to have a one-off Marin County. So we want to make sure we're consistent across the county. So hopefully as early as next week, after Halloween's on everyone's mind now, but hopefully after Halloween is when we'll get that issued next week, or determine if we don't have consensus from the Bay Area, you would still have communication from Marin County, because this is something we think is really important, maybe uniquely in Marin County, because we know Marin County residents really do travel a lot and probably have a lot of plans already. So
Thank you.
Michael Casper asks the question in reference to sports. Any idea when school and private sports competition will be back in Marin?
No, that is purely up to the state. The state has been negotiating with the Interscholastic Federation. I'll get this. It's CIF. I'll figure out the right terms on that, and they have not agreed on that. What we're seeing in there's it's bigger than us sometimes, where it's political, it's economic, some of the decisions that are driven at the state level. And so, for example, we have seen a return of professional sports allowed in the state. And that is driven by the ability of some of those professional sports to engage in testing of players, et cetera. That's not the same capacity that high school or even collegiate athletics have been able to can be able to demonstrate or have the resources to do. So we will not make any, we cannot be an exception to the state rule. Right now it's strength and conditioning only until the state issues guidance. And so I've heard a December date floated around, but I'm not confident that that's going to be the case unless we start hearing it from the state, the California Department of Public Health itself, which is not where I've been hearing the December date. I've been hearing the December date from the school and the athletic side, and not from the Department of Health side. So just to what's the right word? manage expectations. It might not be as soon as some people have been expecting for competitive sports to be allowed. That being said, almost the same quarantine conversation we're having with the athletic trainers is that we are very keenly aware there's students for scholarship reasons who are engaged in private clubs and are competing out of state where they might not have the same strict regulations that the state of California has. And so we are hoping to finalize our guidance on, for example, potential quarantine or testing of students that engage in out-of-state competitive sports activity that would not be allowed in the state of California. Mm-hmm. And I think this is one where we really are understanding a lot of students are really dependent on their scholarships, and their athletics are a key part of their professional, their student academic development, student athlete development. And so are meaning not to be completely restrictive, but to try and create the space that supports student athletes as they pursue some of their higher education aspirations with scholarships in tow.
Great. Kath Nam, great. Very happy the decision tree has come in handy for you. When will we receive the new decision tree?
Hopefully tomorrow. Dr. Willis, I'm calling right now. Hopefully tomorrow he's reviewing the final document. We're doing a copy edit. The other document was a little bit long, so we're trying to simplify it a little bit and clean it up for the second version of it, because there's a lot of repeat sections. We're hammering the point in the beginning, and so we're trying to clean it up a bit. But my goal is tomorrow, the English versions, ideally maybe by Friday we'd be able to have the Spanish versions no later than Monday the 2nd, with implementation the following Monday.
Great. And then this is
a whole week to change course.
Right. And then in 3 weeks, we'll be changing it again. When we get to yellow.
Hopefully, yes, let's go yellow.
Yes, let's go yellow. Okay, so this is from Catherine Hawes, and this is in reference to learning hubs. So she is asking about, she has 2 learning hubs with 14 students each. And can those students participate in a learning hub 2 days a week, also participating in-person learning 3 days a week?
Yes.
So that's because that's 3.
Well, I would see their learning hub is 1 and their school is 2. Is that how you're counting, Sandra? That's how I'm counting.
That's how I was counting.
Okay, great.
So the learning hub batch is 1 and the school is 2.
Yep. I think, and I was able to put in the CDC data tracker, so that's in the chat, so that's great. So any other questions? What are your thoughts on the over-the-counter COVID testing kits you purchased at Costco?
Oh, they're there now?
This is a kit, yes.
They're there.
Is it Everlywell? Is it that one?
No, I put a link in there. Actually, we had savvy parents, and as soon as anything comes out on the news, this is from Azova, A-Z-O-V-A. It's a COVID-19 saliva PCR test, and it gives you a video demonstration. You spit in your little tube and send it off, and the results come back in 24 to 48 hours.
I will look it up.
Is that the same as ours?
Yeah.
No, I'll look it up. We have on our website the ones that we recommend,
okay.
Because so it includes. We are recommending home-based testing as a resource
Okay.
for parents and for families, especially if they've traveled, etc. The ones that we vetted are Pixel by LabCorp, Everlywell, Vault, and Vitagene. I will send these in the chat now. I learn something new every day. So that being said, Costco is so high profile. I think I did everyone. Costco is so high profile that I wouldn't doubt that it would probably be something we would add to our list. I'd be surprised. Maybe I am not a Costco member, but I would be surprised if Costco put their brand out on the line for a non-FDA approved test. But I will review that and follow up with you.
Thank you.
Okay, the next question is Denise. The amount of cohorts, has it changed to 3?
3. 3 is the magic number. My kids get to do mixed martial arts again. Yay! So that's not just for me. It didn't go up to 3 for me. It really went up to 3 because we are in orange. And so, but we, based on this working mom's experience, one of the challenges that I was facing in the red zone is that my kids are would be in school and aftercare and would not have any allowable extracurricular activities, which would be the case probably if we go back to red again. What we need to be prepared for is when we enter into red that things will become more restrictive because we're regressing. That might be Dr. Willis may implement more restrictive orders than the state to gain ground that we might have been perceived as lost from going from orange to red. Green's a long way away, orange to red. But the reason behind moving up to 3 is both the child's well-being, the reality of the changed environment with working parents, especially now that more kids are back in school, more parents will be back at work, and that aftercare school will be 2 cohorts and still allow 1 additional activity for a child for their own physical, emotional, social development.
Okay, another really good question. What do we do if we find out that students are in more than 3 cohorts?
Find the right person to have that conversation with the parent. It might not be you that's the right person. I think people always find the slippery slope, which is why we provided specificity. The state doesn't provide specificity around the number of cohorts. We felt the need because of, as an important strategy to provide specificity. Find the right person to talk to that parent and to just encourage them that, this is really us all. Our goal is keeping schools open. Like they're finally getting open. We've worked so hard. They might poo-poo you. So it's always right to find the right person to talk to them, but just to, and again, check in with them and say, hey, did you know? We're doing our best to promote it, but it's very possible they don't know. That it's very possible they don't read our public health information, and they're just good. They're just excited that we're in orange, and they just see the orange and want to go back to business as usual. And so some parents just might need to check in and understand why we're doing it. It's because we want to maximize social connectedness opportunities as much as safely possible, and recognizing that in every time we're grouping with another cohort, especially out of school, there's more looseness. In school, you're going to have teachers and principals and staff watching this environment, and I know there'll be breaches, but overall, it's a much more structured environment. But as you move further away from school, the risk of non-compliance with our best recommendations, maybe a basketball club I've heard about, that's going to happen. And so the more we can keep small and stay small is the way that we're going to keep schools open. So being ready with why, the answer to the why, and finding the right person to talk to them. They're not going to get a fine, and they're not going to get a call from me. But it's just encouraging for us to work together as a community.
During outdoor recess, our cohorts, how many cohorts can mix on campus during recess? If that's, yeah.
Cohorts should not be mixing. They can all be outside, but the cohort should be in its own zone. So it's not, again, this is where it's not business as usual, where kids came onto the campus before the first bell, everyone's running around. That's not the case when it's, when it is a break time and we really want kids to be outside. That's a great place to be, just to have a breath of fresh air. They don't have to wear their face cover if they're outside. They can maintain 6 feet distance. That's really important, and really trying to maximize distancing when they are outside together, which again, I know their nature is not to do that, but really working with them to try and maximize the distancing, which is probably might feel like a near impossible feat. But again, if the cohort should stick with the cohort, even if they're all outside, they should stick together. And so if one cohort, you can put one cohort on a play structure and then take them off, and then let another cohort go on a play structure, but it shouldn't be a free for all out there. It's a much more structured place than any child wants to be in.
Gail, would you like to ask your question, Gail?
Hi. Yeah. So, you know, in the upper schools, it's more of a challenge to keep those cohorts together because they don't move as a classroom from one class to another class subject. So we have tried to limit the number no more than 18 in a classroom, but yet we still have kids that are moving between 2 to 3 classes each day.
Mhm. And that's allowable under, that's allowable in the middle and high school settings. And that's where we're depending more on students too, as they're aging, to have more, you know, be more responsible, to understand the rules and to follow it. I know that's not realistic either. But again, these are, as long as we have strong attendance and roster, we understand that kids have multiple classes and schools are trying to keep them together, but we understand that it's harder as you get into those secondary groups. And we're doing it well and successfully. We do have some middle and high schools back, not as many as the elementary level, but we have them back. And again, this is where we need to be prepared to adjust and adapt if we're seeing high school or middle school based transmission because of those dynamics of higher number cohorts and more, you know, English class, history class having different students in there. So that's why we're tracking it.
So that 100 number is?
There is no the 100 number went away in August. I know many people, and this has been a pretty common question, because in June, before, again, now is a different place than June. With what we knew in June, we were the first, and this is again, taking a step back, there was no state guidance on schools. When we published the Marin County 30-point guidance, there was no San Francisco guidance, no LA guidance, no Alameda guidance. Marin County, I believe, and I want to, if we're not the first, we're certainly the top first 3 of any county across the state of issuing public health guidance for the return of schools. And so when we issued it in June, it was just, okay, we're going to be the first one. We're thinking small for 2 reasons. One, we were the first county issuing guidance. 2, we didn't have the public health capacity yet for all the things that we're describing. There was no dashboard. There was no school dashboard that was documenting school-based transmission. We didn't have Sandra, Linda Metz, Marsha Grant on a team with 2 other administrative supports ready to go. And now we're in a very different place. So there's no cap on the number of students. It's regular sized classrooms as long as the other 30, as long as the other 29 points are followed, regular sized classrooms can be held. We do have a minimum of 4 feet distance between students. So I know that's an issue that we're starting to hear with high schools, that desks were a lot closer. So we still have that minimum of 4 feet distance, but there now is no longer a number cap. And that's also consistent with the state guidance that has come out. And Marin County, sometimes when you're at the head, when you're leading, it's you sometimes a bit more conservative. And again, we also now have capabilities that we didn't have before. So there is no 100 anymore. That's not our recommendation. Some school districts may opt for it. And I've heard that, well, it was there once, so we want to stick with 100. That felt like a safer number. And that's up to the schools, but that's not our recommendation.
Okay, good. Thank you.
And this goes for learning hubs and, right?
It goes for all of the school-based activities. The exception is my kids are in a licensed aftercare program. So that's the exception. So if you have an aftercare program that's supporting your school and they're a licensed childcare provider, they're still capped in a way that a non-licensed childcare provider, non-licensed learning hub might not be under the same restrictions that the state has. And we don't know when that's going to change. We have no indication from the state if they're going to change the guidance around childcare cohorts. And I think that's, again, they're applying childcare in the sense, childcare is a riskier environment. We've already seen that, especially our home-based childcare. But they're applying childcare guidance at the state level to like aftercare programs with elementary school kids. And that's just a disconnect where it's almost one size doesn't fit all, but we only have one guidance from California Department of Social Services. So that's just where some schools may be stuck and not having a sufficient aftercare supports or services that are needed as we go back online because their provider is regulated by the state and not by the county.
Dr.
Catherine, would you
Santora,
like to?
Oh, I'm sorry, Michelle. I just need a follow-up question on sports. There are kids that are in private sports clubs and they're traveling out of state and they're high contact sports, soccer, whatever. And are they considered, are those contact sports considered high risk activities?
They're higher risk activities, especially as with adolescent groups, because they act like adults. There's traveling out of state to higher risk states, which is why we are going to be updating the guidance. Dr. Willis, we have to make a final decision, basically. Again, you're seeing the sausage being made, whether we're going to mandate a 14-day quarantine and return to virtual learning for competitive athletes, or there might be a compromise with a shorter quarantine with a testing. We just haven't made that decision. Again, we know when we lead, this is a place that we're talking with the other Bay Area health officers, because it's not just Marin County, like those kids on those teams come from counties across the Bay Area. So we don't want to, this is a place where we're trying to find consensus before we deliver our guidance. Sometimes it's easy to be local because it's a very hyper local with our policies and guidance. And sometimes we recognize that when Marin makes a decision, it can have a snowball effect to other communities. So those are two that we think we need to have consensus before we move forward.
And Catherine Haas, you want to clarify your question with Dr. Santora? And I think that'll be our last question. We're almost to 4 o'clock.
Yes, thank you so much. So we are running my questions have been around the Learning Hub, and we're thinking about opening up a second Learning Hub for connectivity, because our people out here in Bolinas, we have a lot of people that don't have internet. So are the cohorts for Learning Hubs still, are the students still limited to 14 in a Learning Hub, or can there be more in a Learning Hub?
If you're a Learning Hub that is not licensed by the state of California, you can have a regular size group, whatever that classroom would allow, as long as you follow the other guidance of having 4 feet, if it's a desk environment with computers, that the desks are 4 feet apart. So if you're not licensed as a child care provider by the state, you can have a regular classroom with desks 4 feet apart.
Okay, Dr. Santora, we are just so incredibly grateful for your clarity and your knowledge and your support. And just want to say thank you so much. That will be our call. It is recorded, so it will be up on our website momentarily. So thank you all so very much for joining, and be safe this weekend.
Trick or treat.